Wow, and thank you very much. I'm glad to have helped you save a lot of money, Miss Patsy. Please don't keep me a secret, okay? Again, everybody, my name is Lena Skills. I am a senior marketing agent for American Workers Insurance Services. Today we're going to be talking about medical benefits. Literally, we are the best company when somebody looks for options and affordability, and that's why we are having a lot of success with our company. If you have any questions, please email them directly to me or my team at myhealthcarepro@gmail.com, and we'll get those questions answered, okay? Now, I'm going to turn it over to Jen, and she's going to tell you for who and why we do what we do.
Thank you, Lena, and to the AWIS reps out there who are getting this work out. So let's talk about benefits and why so many people are looking to come on board with us. Number one, we know that there are over 167 million Americans in this country that have no dental insurance, and we also know there are 65 million people out there with no medical insurance. So no medical and no dental. Well, what are the numbers? What kind of numbers are we looking at? There was an article that just came out in the paper not too long ago, and what's amazing about this is when you look at the numbers, it's over 60 to 70% of all the people who don't have benefits. That's a huge number. Why are people suffering out here? Because when they lose their jobs, they lose their benefits. So the two biggest problems are money and benefits. This is an interesting business to be a part of when so many people need what we have. It's the number one needed product and service in the country. When you're talking about people who need money, the most important need is the roof over their head, and then they begin to worry about health and benefits. And because a lot of people can't afford it, it's not a part of their budget. With the increase in the cost of food and gasoline, people are left with less money. They can't afford $1,000 a month for major medical insurance. They can't afford $150 to $200 a month for dental insurance that limits you to only $1,000 to $1,500 a year in benefits. There are a lot of people who are walking around with a toothache or an accident away from bankruptcy because they can't afford to cover what they need. Benefits, the number one needed service in the country, and we offer that through our company. Folks, we can help anyone with our low-cost healthcare options, and anyone can qualify. How do we do that? Well, how many people do you know that are overweight, have diabetes, high cholesterol, high blood pressure, and are medications? Over 1/3 of the population in our country have diabetes, and over 2/3 are overweight. Let me repeat that in case you didn't hear that. Over 2/3 of the population in our country are overweight in one form or another. When people are overweight, it brings problems like high blood pressure, high cholesterol, diabetes, and a whole bunch of medical problems. Did you know if you have diabetes and you're looking for private health insurance, you can't get it? You just can't afford it. If companies know you have diabetes, they won't even offer it to you. You can get the guaranteed exchange plans across the country in every state that has it, but those plans cost $1,200 to $1,400 a month for just one person, not the family. So there's the problem. So now that you know this, if you know anyone who may have had a heart attack or cancer, let me ask you, can they get life insurance? Just traditional, cheap, affordable term life. Try talking to a life insurance company who asks you questions like, have you had a heart attack in the last 5 years? And if you say, yes, I have had one, you can't get life insurance. So people who've had certain health conditions can't get life insurance unless they get it through a job. And people who've had major problems can't get life insurance. And there are health questions asked, and with dental plans as well, and those plans can be limited to $1,000 to $1,500 a year in benefits. Now, knowing all these issues that people have, if you want to go on Google and search these issues and see all the people with no health insurance, then ask yourself this question. What if we had an association, kind of like a Sam's Club, where people join Sam's Club for $40 a year or $100 a year for upgraded membership? And then they join Sam's Club, they become eligible to purchase stuff at a discount. Well, that's what Sam's Club is about. AAA Club, it's like $69 or $100 a year to be a part of AAA Club, the American Automobile Association. How about AARP, the American Association of Retired Persons? See, these are associations. People join them by paying a fee to get access or become eligible for the discounts and benefits. Well, people, what if you could join an association that's been around since 1983? The National Association of Preferred Providers was established in 1983 as a non-profit organization. What if you can join that association for only $12 a year? And And that's $12 a year for your whole family, whether it's a single person or a whole family. No limit on the number of family members. What if you can join that association for $12 a year and be eligible for medical benefits, life insurance benefits? We're talking about regular term life insurance and dental HMO insurance benefits. And you cannot be turned down for any reason. Doesn't matter if you have cancer. Doesn't matter if you have leukemia. It doesn't matter if you have diabetes. It doesn't matter if you have AIDS. You cannot be turned down for any reason. So if you join an association for only $12 a year to gain access to many different types of medical insurance benefits and dental insurance benefits. Some medical insurance benefit plans we have only cost $59 to $69 a month for an entire family. Some medical insurance benefits plans cost $109 a month for a single person and $159 a month for a family. We have plans that cost $209 a month for a family. We have plans that cost $585 a month for a family. Obviously, the plans that cost $585 a month for a family have more benefits than a plan that costs $59 a month for a family. But even the plan that costs $59 or $69 a month for a family have medical insurance benefits. They are less benefits, more limited. They may not have hospitalization on the $59 plan, but it will have some kind of health insurance benefit. Of course, the plan that costs $585 a month does have hospitalization benefits that will pay $1,000 to $2,000 a day if you're in the hospital for any reason. It will pay for the anesthesiologist. It will pay for the surgery. It will pay for accidents. It will pay for lab tests and blood work and doctor's visits. So if you want plans that cover more, we do have those types of plans with no health questions. No health questions. No health questions. And in case you didn't hear me, no health questions. That's the advantage of joining our association. That makes it the most powerful association in the country, doesn't it? Of course, there's no other association in the country that can guarantee you health insurance benefits. There is no other association that can guarantee you guaranteed life insurance benefits. We are the only ones in the country. We are the only company that is permanently licensed in the state of California. A week and a half ago, we got a permanent insurance license to market some of the plans we market in the state of California. The first company in the history of the state of California. On some of the benefits we market, not all of them, but some of them. That's history, people. No company has ever been offered a permanent license in the state of California, and that just happened a week and a half ago. I feel blessed to be able to offer these types of benefits to individuals, groups, and families, or companies, or corporations, or associations, small businesses with one employee. How about a company with 100 employees and only one wants it? We can do that. Most insurance carriers, if you don't get 75% of the participation of the group, you can't write the group. With us, the minimum we have is one. If at least one employee wants it, we can sell it. That makes us pretty unique, doesn't it? So when you look at the benefits we have to offer, what's really cool is we can change what we have. We can modify our plans and actually change it up if we have to, specifically to tailor to a company, a corporation, a church, a union, a nonprofit. We can do all these types of things for businesses out there because of the way we structured our benefits. Most insurance agencies, if you are a licensed insurance agency, you market Blue Cross Blue Shield and Aetna, Humana, and you go to a client and you say, I have all the major medical insurance brands. We can sell you anything you want as long as you buy the products that are already done for you. In other words, a client can take a look at all the plans you have and all the deductibles, but that's all you can sell. What makes us different is when we file with the Department of Insurance Association benefits, we filed them as benefits. Therefore, the benefits are all approved. We can talk to companies and say, what would you like? If you don't like any of the plans, what would you like? We can literally take the benefits that a company wants and design a whole new plan. Since the benefits are already approved in the Department of Insurance, we can design a whole new plan with different price points until we find what a company wants. That makes us different. That makes us unique. We are the only company in the country that can do that. That's what makes us different with our medical insurance benefits. And of course, our dental insurance benefits we have is the largest dental insurance company in the country. The company we work with has been around since 1954. That's 58 years and counting. It's the largest dental insurance company in the country with over 25 million customers currently, and that's pretty big. This company, they work with some of their clients, the federal government and active duty military, so it's pretty good to have them. On the medical side for benefits, we use an insurance carrier, U.S. Fire and Insurance Company, which is part of Crum and Forrester. This company has insurance coverage in almost every country in the world. They've been around since 1896. It's over 116 years. They have an A rating on the AM Best, which is an independent company that rates insurance companies on financial strength. An A rating is the second best rating in the world. Okay, and they're in almost every country in the world. They do close to $20 billion a quarter in business. that's who underwrites our medical insurance benefits. Pretty impressive, huh? So we have a combination of these wonderful benefits that people can get access to once they join our association for $12 a year. That's a pretty good deal. Now, where can you see these benefits? Where can you learn more about these benefits? Your web will provide the Rep Direct dental or medical plan websites in either email, by phone, or in a direct presentation. But you can also visit www.nappassociation.org to become a member of the association for $12 a year. You can also visit www.awisdental.com. That's www.awisdental.com for dental HMO, where you will find that we have the lowest copays in the country and no annual limits to your dental benefits. You can download a complete fee schedule with the copay details as well as a list of providers. And you can also visit www.awiscard.com. That's www.awiscard.com for the medical plans. Of course, you will need the Rep ID to completely log into the dental and medical plan websites. These sites do not have all of the options that are available to you because we make custom plans as well. You will have a starting place to learn what's available to you. And if you have any questions, feel free to email Lena Scales. Her email is myhealthcarepro@gmail.com.
Wow, thank you very much, Jen. I did want to mention one more website. It's for a free prescription card. It's www.awisfreerxcard.com. And what that card does for you, it saves you 10 to 50% on your prescription meds. It's even saved me 80% on a prescription that my insurance didn't even cover. So go get your free RX card, pass them around, tell everybody about us, and everybody have a great day.